Hi there, I'm Sarah Stapleton, functional medicine practitioner at Merit Wellness. Let's talk about treating the most common cause of dysregulated menstrual cycles, PCOS, polycystic ovary syndrome. It affects about 5 million women in the US alone. Traditional medical treatment for PCOS is almost always to put a patient on metformin and birth control pills. Metformin is a diabetes drug that helps to control blood sugar. One of the downsides is that it depletes vitamin B12 in the body, and most doctors don't bother to suggest taking a B supplement while you're on metformin. While it can help lower blood sugar and regulate your periods, it's not good at helping with weight loss. And studies show that losing as little as 10% of your body weight could be enough just to regulate your menstrual cycles. It's worth noting that 1 in 3 women have what's called lean PCOS, where weight isn't a dominant factor. However, blood sugar is. So we still need to be concerned about managing blood sugar, just not with metformin. Metformin also comes with a host of unpleasant side effects that not everyone can tolerate. And it's also worth noting that it doesn't improve pregnancy outcomes. As for birth control pills, they don't regulate your cycle. They hijack your body's natural hormonal feedback system. And as a former drug rep who sold the world's most popular birth control pill, I assure you, there's nothing natural about using birth control pills to regulate your menstrual cycle. So here are some general tips I use for managing PCOS in my patients, keeping in mind that there's no one-size-fits-all approach. Tip number 1, clean up your diet. I bet you saw that one coming. I can guarantee that you instinctively know how to do this. You just need to commit and make it happen. And here are the basics, okay? Cut out added sugars and processed foods. Eat more whole foods. Eat the rainbow, but not Skittles. Lots of vegetables and fruits. Aim for a 2-to-1 ratio, more veggies than fruit. Eat plenty of healthy fats like olives, olive oil, avocado, real organic butter, wild-caught fish. Don't use vegetable oils or canola or corn oil. Minimize carbohydrate intake, but don't do a ketogenic diet. Okay, we're going to just aim for net carbs of 60 grams a day. And you calculate that by taking your total carbs, subtracting the total fiber, and that's your net carbs. But you won't count green vegetables or carrots or beets. Okay, those are free foods. Cut out caffeine and alcohol. Green tea is okay. Minimize cow, dairy, and soy products. Eat every 2 to 3 hours to stabilize your blood sugar. If your stomach growls, you waited too long. And hydrate, hydrate, hydrate. That alone can help you lose weight. Not to mention that it helps to detox the body. Aim for 90 ounces a day or more if you're active. And something else to consider that might help you kickstart your health is a 28-day detox and purification program. Tip number 2, move your body. Find something that you have a chance of enjoying. Think yoga, Zumba, brisk walks, indoor cycling, dance, weight training. A little bit of something's better than a whole lot of nothing. I mean, as kids, we looked forward to it and we called it recess. Now it's a workout. And some people are okay with that, but for others, that thought just triggers stress. And by the way, tip number 3, de-stress. Once you make it a habit, you'll look forward to that time. So consider things like hatha or restorative yoga, walks in nature, even if it's a downtown park, journaling, meditation that's silent, guided, or chanting, Epsom salts, baths, massages, a combination of all the above. Even if it's just squeezing in a few moments of deep breathing every day, make it happen. Tip number 4, get good sleep. You shave time off the end of your life with chronically poor sleep. That's a fact. Establish a regular bedtime. Make sure your room is dark, and I mean dark, and cool. No screens in the bedroom. Period. Phones, tablets, computers, TVs, nada. If you tend to wake in the middle of the night, try having a snack with fat and protein like a spoonful of almond butter about a half hour before bed to help keep your blood sugar stable. And tip number 5, some supplements. Here are some of my most frequently used supplements. Inositol. This influences the action of glucose on insulin, and studies suggest using a combination of myo-inositol and D-chiro-inositol in a 40-to-1 ratio. That's around 2,000 milligrams of myo to 50 milligrams of D-chiro. 5,000 IUs or international units of vitamin D3 a day. We're almost all deficient in it, and it's crucial for hormone signaling in the ovaries. N-acetylcysteine, or NAC, that's a precursor to glutathione, the master antioxidant in the body. It regulates insulin receptor function, it improves egg quality, and it lowers testosterone. Take 600 to 1,200 milligrams a day. Zinc. Studies show women with PCOS tend to have lower zinc levels. I recommend taking 60 milligrams a day. And we associate melatonin with sleep, but it's also found in the follicular fluid in the ovaries, and it serves an antioxidant function. Take 3 milligrams at night before bed. No need to take more than that. The list could go on for supplements. So the bottom line, there are better ways to deal with PCOS than pharmaceuticals, and it's so much better for your long-term health and vitality. If you're interested in learning more about managing PCOS without prescription drugs, reach out to Merit Wellness to speak with me or one of our other qualified functional medicine practitioners.